Welcome to our second bite-sized video, where we aim to provide you with a brief overview of Part 3 of the Health and Care Staff in Scotland Act 2019. This video will be focusing on arranging staffing and the responsibility of providers, which is applicable to all childminders. The term staff refers to whether you have an assistant or a sole childminder and you're considered your own staff. This is the first legislation in the UK to set out requirements for both health and care services with regards to staffing. Enacted in April 2024, it affects legislation that guides the requirements of the services you currently provide. The Act links together supporting documents and guidance already in use and has now been put into legislation. The previous legislation that covered staffing was Regulation 15 of the Scottish Statutory Instruments. It was a small paragraph in the instruments which detailed how providers must have regard to the size and nature of their care service when arranging their staffing, and ensuring that at all times suitably qualified persons were working in the service. The asks of Regulation 15 are all still present in the new Act. It just goes into a little bit more detail as there is a focus on the recognition, as we all know and appreciate that high-quality staff provide a high-quality service. Part 3 of the Act outlines the duty on care services to ensure appropriate staffing. You still need to fully consider how many staff you need to provide your service. The legislation does not impose specific staffing levels, and the care inspectorate ratio guidance will not change in this time. However, you need to consider how you arrange your staffing around children's needs and not set ratios. As the given ratios are guidance, Part 3 of the Act details how you should determine what constitutes appropriate staffing levels by considering the nature of your service, the kind of service you provide, the size of your care service, your aims and objectives, the number of children experiencing care, and the needs of these children. It is also Part 3 of the Act that details the training of staff and the responsibility on childminders to ensure staff are appropriately trained to carry out their duties. To fulfill previous legislation, we have asked during inspection about training logs and induction plans and checking the regularity of scheduled supervisions or appraisal systems, if they have an assistant. This is in order for you to assess, monitor and plan appropriate training needs for yourself or individual staff if appropriate. This means the ask of the Act about staffing receiving appropriate training for the work they are to perform and being assisted to ensure professional learning is current is not a new ask. Here on this slide, there are 3 reflective questions which you could consider with regards to training for staff and part of your self-evaluation process. This slide demonstrates the similarities between Regulation 15 and the Health and Care Staff in Scotland Act 2019, with wording from Regulation 15 on the left-hand side of the table and wording from the Act on the right-hand side. The only addition can be seen at the bottom of the slide, the well-being of staff. Part 3 relates to how staff well-being will affect the main purposes of the Act by providing a safe and high-quality service and ensuring the best outcomes for children. A few examples may be: do staff feel safe to raise issues without fear of retribution? And is there a culture of service improvements and not blaming individuals? Considering staff views about the number of staff needed for the children they are currently caring for, and their ability and your ability to cope with those children's individual needs. Childminders need to consider how they support assistants and themselves to feel confident in their roles and responsibilities they are to carry out. Are your assistants included in reviewing your risk assessments, policies and procedures in order to achieve those improved outcomes for the children? How do you look after your own well-being and your ability to cope with those children? More information about staff well-being can be found in the first bite-sized video, where we discuss it in Part 1 of the Act. Part 3 of the Act It also details the training of staff and the responsibility on providers to ensure staff are appropriately trained to carry out their duties. Please explore the Safe Staffing Hub page for additional resources and support. On the Hub page, there is another bite-sized video where we go through Part 1 of the Act, and you can find a variety of related guidance documents and the statutory guidance for the Act. For more information or in-depth presentations, please watch the recording of the webinars which were held in January 2024. You can follow along with the accompanying presentation slides on the Hub. Thank you for watching this bite-sized video about Part 3 of the Health and Care Staff in Scotland Act.